Hi, Dr. Tammy Penhollow with Precision Regenerative Medicine. Today we're going to talk about platelet-rich plasma therapy, or PRP. What is PRP, you may ask? You may have read about it or heard about it on social media or about some famous athletes having PRP injected to maintain their ability to participate at that professional athlete level. What it is a therapy utilizing your own blood. Your own cells are injected into your body at a site of injury or a site of chronic inflammation in an effort to stimulate the body's ability to heal itself. In a natural healing cycle, the body rushes platelets to that site of inflammation, and those platelets release their growth factors and their anti-inflammatory mediators in an effort to start the healing process. In PRP therapy, we concentrate that and hopefully accelerate the process. Your own blood is drawn, it's concentrated in a centrifuge, and then a small layer is drawn off, which contains that group of anti-inflammatory mediators and growth factors, and then those are injected sterilely utilizing either a C-shaped X-ray in the case of a spine injection or an ultrasound in the case of a joint, ligaments, tendons, muscles. This allows us to precisely deliver those growth factors and anti-inflammatory mediators at the site of injury, and then we let your body do its thing. It wants to heal itself, and if we put your own cells into the area, we're likely to achieve that, maybe on an accelerated path instead of just letting you heal with time. What PRP is not. PRP is not a steroid, and it's not a foreign chemical substance. Therefore, it's not likely to decrease your ability to fight an infection or even make you more susceptible to an infection. It's not likely to cause any issues with your body's ability to maintain its blood glucose levels in diabetics. It's not going to create any issues with keeping that calcium in the bone and increase your risk of fractures from osteoporosis. And it's not going to cause any rejections because it's your own body cells. Where can you inject PRP? PRP can be injected into any joint, for example, the knees, hips, shoulders, elbows, the small joints of the hand or the small joints of the feet. It can also be injected into the surrounding tissues, ligaments, tendons, muscles, and an ability to fight an injury in those areas. And in the spine, it can be injected into the small joints of the spine called the facet joints, be injected into the ligaments and surrounding tissues, and it can also be used in the epidural space. Instead of an epidural steroid injection, it's an epidural PRP injection, and PRP can be injected into the discs of the spine. On the aesthetic side, PRP can also be utilized in a microneedling process into the face to help cell turnover and induction of collagen and hopefully promote a youthful glow. It's also been used in the hair to stimulate hair regrowth in certain situations. I personally perform these injections. I perform the consultations, and a consultation can be as simple as something like this here on the web, or we can do it in person in the office. All of the procedures are done in person in the office and don't require us to go to a hospital or a surgical center. If you think PRP may be for you, please reach out. Would love to meet you and would love to take care of you. Thank you so much.